welcome to another edition of Mississippi Stories. I'm your host, Marshall Ramsey, editor-at-large at Mississippi Today. You can always check out our coverage at MississippiToday.org, or you can see some of my cartoons there as well. Well, as you've noticed, the COVID crisis has once again peaked with the Delta variant, which has hit Mississippi incredibly hard. If you notice, the daily number counts have risen into the 3,000 and 4,000 range, which means a lot of people are going to be dealing not only with, just trying to recover, but also long-term recovery as well. And I'm very excited to have on the show today a couple folks who know a lot about long-term recovery of COVID. They are part of the Methodist Rehab Center's Recovery After COVID Clinic. And we have Rhonda Meadows, who's a nurse practitioner and clinic coordinator, and Dr. Michael Montesi, who's like the old Hair Club for Men president, who was not only the president, but he was also a member. And you are a long-term COVID survivor. You are a COVID survivor. I cannot believe that you were on a ventilator for 27 days. Congratulations for beating that and beating the odds and being here with us today.
Thank you. Happy to be here. Thank you for having us.
Oh, sure. Well, Dr. Montesi, I guess probably a good place to start would be with your story, because it's very, very powerful. I see the date here when you actually had the respiratory arrest, and that was, I guess, last year on July 26th while you were at work. Did you have any symptoms of COVID before? Did you know you had COVID?
Actually, I did. When pretty much like a lot of the patients we see initially, just fatigue and fever. I actually was home for about a week. First illness or fever I had was July 14th, 2020. Stayed home for about a week doing the normal, at the time, what we considered the normal standard of care. Then progressively got sicker, more fever, more shortness of breath. And one afternoon, finally on the 24th, my fiance came in, and I very, very difficult time breathing. Couldn't really complete a sentence without being significantly short of breath. I was actually admitted to the hospital where I work at Spartanburg Medical Center in Cleveland, Mississippi, on the 24th, and went into respiratory arrest on the 26th. I was intubated and then airlifted to Baptist, admitted to the ICU there under Dr. Rapai. Stayed on the ventilator. By the time I was on the ventilator for 21 days, but the entire time on intubated and with a tracheostomy was 26 or 27 days, like you were saying. When I did wake up, I was actually paralyzed. I could move my head a little bit.
Wow.
Looked down. I had no recollection of being ill that week that I was home. So to me, it was a pretty shocking to be not, in a hospital that I didn't recognize, but also not able to move. And I guess per pretty standard physician protocol, I was not a pleasant or good patient at the time. It was kind of a tough pill to swallow, I guess, so to speak. Wound up being in the acute care phase of the hospital for about 6 weeks. Had started to be able to move my extremities, my distal extremity, my hands and my feet a little bit before I was discharged from Baptist. And came and spent, I think, right at a total of 6 weeks at Methodist Rehab, learning to walk, basically everything, walk, move, feed myself, basic hygiene. When I did go home, I think October the 11th, I was still on oxygen, which I wore until December, and was still on a walker at the time. I missed a total of 8 months of work. I actually resumed my clinic in Cleveland at the end of February. And during my time spent at Methodist, I developed a good relationship with the staff and Dr. Art Lace, who's actually been here quite some time. I think you're familiar with Dr. Lace, who's done a tremendous amount of research and incredibly knowledgeable from a neuromuscular standpoint. He was the one that actually did my initial neurologic studies And just through his experience was able to tell me, what he thought would happen, what to expect, and pretty much like clockwork, everything that he, anticipated came to pass. I recovered slowly, but small muscle groups, the extremities came back first. Large muscle groups took a while. I was here almost 3 weeks before I took my first steps, and I think I walked a total of 4 feet the very first time. But I was on a lift and with a walker, but after about 4 feet, my heart rate went up, my oxygen level dropped. I had to sit down and rest. They were like, okay, I think that's enough for today. But I'm a little, I guess, smarter than average redneck. So I just kind of, so let's do this again. I think I went about 9 more feet. It took a while, but by the time I left, I was walking 1,000 feet with a walker. And it took some time to recover even at home. But, very blessed with lots of really good physicians, maybe just a little hard-headedness and perseverance, and a lot of thoughts and prayers, but have recovered quite a bit. I developed I guess you would call it a pretty significant finding or complication. They found a mass when I was in recovery here at Methodist, and actually wound up being melanoma. So I have stage 3C melanoma as well. And I'm doing well from that standpoint. Recently underwent some different therapies and seem to be doing well and recovering. So again, very blessed. But through that process with Dr. Lace, we started talking and thought that's when kind of long hauler syndrome was starting to kind of show its head a little bit, and felt like this would be a long-lasting illness, which obviously, like you said earlier, we're seeing a new surge of acute infections, which I think in turn is going to leave us with a lot of the stuff that we're seeing now in this type long type COVID thing. So we talked and seemed to be a good fit. Currently, we're doing 1 day a week, which may grow depending on the need. We initially started with just Methodist patients because we had all of their records available. And about a month ago, maybe 6 weeks ago, we opened it up to the rest of the state. So we're taking patients from all over the state. I think we're the only right now long hauler clinic in the state or in this area. And what we're doing is we initially see those patients. We have a set of tests that we've gone through and established, and what we're trying to do is link some of these patients with some of the problems that we're having, and kind of seeing what ties them all together. And once we can start to figure that out, then hopefully we can start to maybe suggest some therapy for their primary care physicians, and give some feedback to help along the way.
Let me ask you this question, because we see these numbers, and it's funny you mentioned Dr. Lace, because I think about West Nile, and of course we'll touch on that in a little bit, because that's the big reason why we're sitting here talking right now, is because the work that Methodist Rehab did with West Nile patients has kind of evolved into what y'all are doing.
Correct.
But in a sense that COVID and West Nile both, you don't know how it's going to react in you. There's some people that might get a light case of it. Then there's other people that, and I've had a couple friends that literally were getting last rites from it. And you were almost in that situation where you had a huge reaction. It's not just a respiratory disease. Like you said, you were paralyzed and attacked that too. So what percentage of when we see that 3,000 new cases a day, how many do you think of those people percentage-wise will end up being a long COVID?
I think
good bit.
I think the numbers that we're seeing is at least 40 to 60%. So if you average it out, it's 50%. Yeah. And those things will vary. There's a few things that we see in almost every patient. But I think when you go back, there's a list of 40 to 45 symptoms that some are very significant and life-altering, and some are very mild. And, I've even seen a few patients in my regular clinic that haven't even associated some of the things that, they'll come in and say this or that. And I said, well, have you ever had an acute COVID infection? Well, yeah, I did. Last August, and really, okay, well, was it bad? No, it wasn't really bad. But I mean, I was home a few days, had some fever, and recovered, and seemed to do well. But they don't realize that maybe the shortness of breath with exertion that they're feeling now, actually may be related to their COVID infection from 6 months ago.
Even tachycardia, whenever they exert themselves, they feel lightheaded, or if they stand up, they feel lightheaded and their blood pressure is falling. We've seen that. And we've seen the major things like nerve compression from being in the ICU bed for 3 or 4 months, and drop foot, and all the major things. We also see what we call brain fog. They just can't concentrate. Their memory's lessened, and they have trouble with that. So we're here to try to help with all those things.
Yeah, no, my sister had the brain fog, and it about drove her crazy. And another friend of mine, who's another cartoonist, had that same thing. They said that's the worst, because he says, like, suddenly you're trying to grab things in your brain and they're just not there, and it drives you nuts. Dr. Montesi, I want to say too, congratulations on them catching the melanoma, and I'm class of 2001 on that. So I hope that in 20 years we can have this conversation and say, hey, we beat you. So
yeah, well, thank you.
Wish you well.
Congratulations to you.
What's that?
I said, and congratulations to you as well. You're still going strong, I see. So
yeah, no, it's great.
Yeah, absolutely.
Yeah, it screwed up my career as an international back model, but other than that, it's been all good.
I understand.
And Rhonda, just looking at what y'all do, number one, how do you get a patient? I mean, how does somebody end up coming through your doorstep? And when they do, what is the process? And I was just looking at all the different occupational, from a nurse practitioner to a physical therapist, the long list of people that you do when you put together a plan. But talk about that process a little bit on how you say the doctor came through the door, what kind of plan would you put together for him?
Well, we get referrals from all over the state now, and we concentrate too on our patients that we see upstairs.
Yeah.
But you don't necessarily need a referral. If someone needs us, they can just call the number and we get them there. But once they come to the door, they'll be first seen by a pharmacologist, and she'll go over the medicines and make sure there's no interactions or no discrepancies with the medications they're taking. And then Dr. Montesi comes to see them, and he'll spend a good bit of time with them. Not being facetious or
knocks the door.
Yeah,
hey.
Yeah. But it's good because they get to see him and what he's been through, and say, hey, if he's here, I can get here too. And it's encouraging to have him here with us. And then they'll go for a respiratory evaluation with pulmonary function test, usually seen by a physical therapist, occupational therapist, and a speech therapist for evaluation. If they have any nerve compression problems, we'll refer them to Dr. Lace for nerve conduction studies. And then we also have neuropsych available if they have any anxiety or depression or even memory problems and they want to have a memory test done. And we also have a nutritionist here if they're having any issues with taste or smell issues. We can help them with that. So there's a diverse team that's here available for our patients that help out.
There's no silver bullet, obviously, to cure long COVID. And I mean, if there were, I think we would have heard about it on the 6 o'clock news. But it sounds like the way y'all attack this is just a multi-directional approach, almost like you did with West Nile back, or you still do, I guess, with West Nile. Talk a little bit about that, because I mean, what in your experience, Dr. Montesi, when you were recovering, which by the way, you have made an incredible recovery, and obviously attitude must play part of that, but it seems like that's really a great thing too for you when you're dealing with patients, when they feel like it's all hopeless and you can say, No, actually, you've got
Right. It is the very first patients we had. I was actually in therapy with
Oh,
when
wow.
I was here,
Yeah.
and so they were coming in as I was finishing. And
Yeah.
she was like, "I remember, you seeing you, and a lot of times they would ask because, despite my, despite being 51, I know I look incredibly young. They would say, "Wow, what's he doing in here?" And so the therapist would ask if they could tell my story, and I'm said, obviously anything that I could learn from, or they could learn from, or be encouraged by. And I wound up actually seeing a couple of patients while I was here. They would, because it can be very discouraging when
Yeah.
you were highly functional and pre-COVID. Now all of a sudden you're paralyzed or you're weak or you can't breathe, and so people would get just down and poorly motivated, don't want to go. Well, what's the use? Can't walk. I'll never get back to where I was. And so I went by and talked to a few patients even while I was still here as an inpatient. And, it seemed to help. And to me, it was encouraging that, as somebody with I guess, a strong faith and, realizing that, hey, I'm here for a reason. Sometimes, you just have to be able to find that reason. Because previously I'd worked in 2 different hospitals, a couple of nursing homes, clinic. We were the hospitalists as well. So obviously I've cut some of that back just out of necessity and ability. So now I have to find that next door that opens, and this was one of those. And so it was nice to, when they walk in, oh, I remember you. You were, you rang the bell. What you do at the end of therapy here at Methodist, ring the bell kind of signifies you're through. You've reached that point. And she said, when you were ringing the bell, I was just in my first or second week here, and wow, look at you. You're up and walking. You're not oxygen like you were, and it does seem to be encouraging to somebody. And so when they first come in, and I talk to them, I ask if they know anything about me or why I'm here, why I'm the physician that they're seeing today. And it does seem to make a difference. Like, oh, okay, wow, you've really recovered a lot. And knowing that, I was on the ventilator, I couldn't walk, I had a lot of the same issues that they had, and still do to some degree. I still have some respiratory issues, tolerance, the ability to work 60, 70, 80 hours or things like that, like I had previously been doing. I'm not supposed to be working as much as if you talk to Dr. Baker, my oncologist, he just shakes his head, but I work a lot more than I'm supposed to, quote, but I'm not somebody that sits very long and never have. So being there, and plus I've taken care of some of these patients in Cleveland for 20 years, and I have an obligation there. So I still do a clinic in Cleveland 3 days a week. I'm here on Mondays, and then I work in a nursing home on Friday. So still pretty busy, but being, recovering and seeing some patients that can't walk. And we've had some follow-up after that first initial visit where you kind of see everybody. I generally see those patients back in a month, and we go over all their labs and their findings from the breathing test, the pulmonary function test, respiratory, see how well they're progressing. And we try to compare, how they were functioning and what level they were functioning when they were discharged from the hospital, how they were functioning the first time I saw them, and how they're doing now. After that 1 month visit, then we can see them back, once a month. Generally, we see them back in about 3 months. And sooner if they need it. So anytime they need some between, they just give us a call. Rhonda fields those calls and tries to put out if it's something we can handle over the phone. Fine. If they need to come in, we can do that as well.
We also try to contact the patient like 2 to 3 days afterwards, go over some of their lab work. Because a lot of people in the lab work, we test for antibodies. And that's one question they want to know is, do I have antibodies or do I not? So they're excited to hear that. And then I go over with them what the physical therapy and the occupational therapy thought, if they would benefit from some more therapy, and we can refer them to therapy. And if their pulmonary functions tests were not as good as we would think they would be, we refer them to a pulmonologist if we know they would benefit from it. But most people already have a pulmonologist, but if they don't, we get them to somewhere that they can be seen.
Yeah, like I said earlier, people just don't realize that COVID doesn't just attack the lungs, which, by the way, Michael, your CAT scan, one of your coworkers said it was the worst one they had ever seen.
I was actually talking to Dr. Benny Wright, who put a central line in after I coded. He was one of my partners there in the hospital, and I actually saw him this week, and he said it was the first MEC meeting I'd been back to, medical executive committee that I'd been back to the dollar. And he said, I didn't think you would make it at all when they flew you out. He said there was one of the radiologists called back and asked if I was still alive at that time.
Really?
It was like, I've never seen a CAT scan that looks like that in anybody that made it. So it was very difficult. And looking through my chart afterwards, of course, having enough medical insight to know what I'm looking at the time and looking at my numbers, it is pretty amazing to think that my oxygen levels were so low, my chest X-ray and scans were so bad. So it's pretty amazing, to me that there's not more damage, like hypoxic brain injury, those sorts of things. Because my oxygen levels, after I've been in the hospital about a week, my oxygen levels were still in the 50s and 60s.
Really?
Yeah. After I was on the ventilator and everything. So just my lungs were so full of infection and fluid, and just not a lot of room for oxygen. So, but amazingly, I was blessed enough to have my faculties about me, and my fiance the other day, I woke up on August the 13th, and so she patted me and she said, today's the day you woke up. And I was like, oh, okay. She said, I'm so glad you're here, and then the next day she patted me and she said, and today you were really, really mean. And I was like, what? And she said, it wasn't until about Thursday that, you got to be nice. Because I guess I was probably scared, unsure, why and what. I initially thought I'd had an automobile accident. And I asked her, did it hurt anybody? And she said, what are you talking about? I said, why am I paralyzed? And she said, yeah, COVID. And it took a few days for that recollection of even that week that I was home to come back. And I don't know if it's from, the COVID and the oxygen or the medicines that I was on for so long. But in either case, it took a while. So kind of like with everything else. But, like I said, I'm very blessed and I'm doing well now. And have this opportunity to maybe use that information to help others and kind of encourage and guide. And I've actually spoke a couple of times in a few places up in the Delta, on a couple of hospitals and talked about our clinic and what we have to offer. And I've had a couple of nurses ask, would you speak to, our church on Wednesday night, or, come in to see a garden club or speak at Lions Club, or I don't know. It's whether it's a testimony or you want to call it that. There's so many people that have been where I am and varying degrees of illness. We've seen some of the patients in our clinic now, weren't hospitalized, weren't major, I had fever for 2 or 3 days and I seemed to do okay. And I was weak and tired for a week or so. And then they get better. And then 2 months later, we have a gentleman that, was fine, no health history, nothing, actually had recovered from COVID, had his Healthy U exam, with his physician about a month or so after his illness. Everything checked out great. A couple of weeks later, he had a stroke. And he's not hypertensive, not a diabetic, never been a smoker, weighed 190 pounds, had previously been very high functioning in employment and work, and just and there's nothing else that we know that COVID causes problems with circulation or coagulation. We see people with, blood clots or bleeds, things like that. And we really don't have anything else to attribute his stroke to. He's recovered and seems to be doing well, but, it's those types of things. And like I said, he had an illness an infection where he basically just stayed at home. He wasn't on the ventilator. He wasn't in the hospital. He wasn't, prolonged over months. But
then he went to the hospital with a stroke. So
mm-hmm.
It's amazing how this virus has affected, like you said, not only pulmonary. There's people that has strokes, blood clots. I've seen one upstairs that was on dialysis and required dialysis, and she was in her 50s and no hypertension or anything else. She worked in the hospital as a medical assistant and got COVID. So that's how it affected her. So it's not only the debilitating disease, but those that don't even go to the hospital come with, I just can't think right. It's just the mild symptoms that, or I'm just not where I want to be, where I was before COVID. Something's going on. So, and that's why we try to help them through this and try to figure out what's going on and what we can do to help them.
And it affects me. It's so crazy that it seems to, we had a young lady recently, and I think she was on the Methodist site that was a teacher. She was an art teacher.
Yeah.
And her main thing, she had some weakness, but she had some almost like paralysis in one arm. And it wasn't her dominant arm, but as an art teacher, it made a difference. And how am I going? And so her concern was pretty much twofold. But a lot of anxiety and depression. Am I going to be able to return, to work and teach? Can she taught children? And that was very, very important to her, in her ability to draw and go through that process. And very same way, we had a guy that was a tow motor driver, and it affected his leg, so being able, and he had paralysis in his foot and drop. So it seemed to hit almost at home with certain individuals. And, it's a weird thing to see, but, it affects that ability to, and it does, if you weren't able to use your hands as a cartoonist, you would be like, wow, am I going to be able to do, what I've always done, return to my level of functioning.
Well, even that in the brain fog too, not to think, because you're only as good as your ideas. No, I completely get that. And I completely understand why the levels of depression and anxiety have shot up during the pandemic too, because people are going through that. And I still go back, number one, this was last year. So this wasn't the Delta variant that got a hold of you. You were very young to have the reaction that you had.
And it took a little while, and I think it probably had a lot to do with the fact that I had a malignancy, but I didn't know I had cancer at the time. Right. And so when they intubated me, they did my CAT scan, and they made a quote incidental finding of a soft tissue mass on the right side of my chest. Well, by the time that I had, it was 2 centimeters at the time. By the time I got out of Methodist, it was 6.5 centimeters.
Oh wow!
But it tripled in size in 3 months.
Yeah,
it's so it was crazy, and we're finding some of those things that, is there a link with COVID? And there are some studies now that actually show that, COVID itself may actually suppress the body's ability to fight or slow down cancer, and so it's really weird. I think there are 2 or 3 now melanoma patients that we've seen, after COVID, and we're looking at that, possibility. So
I think one had melanoma, and she was, and then she had COVID, and then she found out that her melanoma came back, which is kind of interesting.
Yeah.
I completely understand that. When I had mine, my dad had bladder cancer, and I was so, just upset that my immune system obviously got suppressed, and I got shingles.
Mm-hmm. Oh, yeah, absolutely.
It got shingles down my back, and right at the tip of where the shingles was is where my melanoma ended up being. So I've always said, I ended up suppressing my own immune system just through stress.
Right.
But and that's like I said, that makes a lot of sense, just because I know that COVID does tend to, like I said, there are studies showing that. Wouldn't you like to be able to get in a time machine and go out 20 years from now and see what they finally figured out about this stupid virus and why it's doing all these things? But y'all do that. There is like a research component to what y'all are doing, isn't there?
Oh, absolutely. And it's cool, but to me, it's although I wouldn't want to go back and do the full 4 years, it is kind of like going back to med school, because I've never been a researcher, and Dr. Lace has been a researcher for so long. So he has a lot of insight that, I don't have. He's an amazingly bright guy. And so I'm learning, to look and how one of the things we're doing is does every, we see certain markers on labs, and we're trying to say, well, does everybody that has foot drop or arm drop or nerve weakness or, neuropathies, are these the ones that have these inflammatory markers, or, what ties these people together, and how does that, how do we address that? How do we, we treat that? And
how does it correlate to
right.
COVID? And
each one of them tied together. And what we try to do, and about a few days after I see those patients, we do all these labs and studies and therapy and breathing tests. Rhonda will send a note back to their primary care doctor, because we're not trying to take anything away from their primary care. It's just, this is rural Mississippi, and there's not a infectious disease, pulmonologist, cardiologist, neuromuscular guy on every corner in Shaw, Mississippi. So we basically say, hey, this is what we think. You may want to look at doing this. And if you need any help with that, let us know. And we can refer to cardiology, pulmonology, endocrinology. We see some people with diabetes that this disease just takes their control off the map. They were well controlled with their diabetes, and all of a sudden their sugars are out the roof, and which obviously poorly controlled diabetes makes everything else worse. And so, how can we help stabilize? And so we make some suggestions, send them back to their primary care doctor, and then leave it open to the fact that if you need us, we're there. We can help you. If you're a cardiologist, a pulmonologist, a neurologist, or you need us to try to set up therapy, we can try to help your primary care doctor do that. But, just know that, your primary care doctor is taking care of you for so long, and that's your mainstay. And if we can help you in anywhere, any part of that, let us know, and we'll be happy to.
Yeah, Rhonda, one of the things I really love about what y'all do is you do put together that plan. And of course, you do share it with the primary care physician. But I can tell you from being on the patient end of things, and when you're dealing with stuff, and like I said, I can only imagine on the COVID front, if you're completely feeling hopeless and frustrated and scared, a lot of times you're just basically, when a doctor talks to you, you're going to hear Charlie Brown's parents, and you might hear want COVID, but that's about all you're going to hear. So to be able to have that plan and have that say, okay, this is what I've got to do. These are the baby steps I've got to take. I mean, that's huge.
And this coordination with not only our team, but their doctors too, to kind of get them in the loop and let them know what we've done and what the patient may not reveal everything to their primary that they reveal to us. So that can.
And I think the follow up too, when they come back in a month and we actually sit down and talk to them. I grew up in Shaw, or in the bean field outside of Shaw. And so, seeing somebody and walking in and saying, you've got, myopathy of chronic illness with associated lumbar radiculopathy, and I think neuromuscular study, and they just look at you and go, wait, what? And, being able to sit down, and I learned real early, going back, because I practiced in the town in Indianola initially where I grew up, or, being able to sit down and saying, your legs don't work because the virus kind of dumped on your nerves. And I really think, Dr. Lace did some studies, and I think this is going to get better, and reassuring them and talking to them in that manner, and breaking it down into what we found and what we want them to do and what to expect. And to that, to that end, they seem to be very pleased, because they maybe have a little better understanding of, they're not really odd, any odder than anybody else that has, a lot of people are feeling and experiencing the exact same things that they're doing. I try to share, hey, we saw somebody last week that, their foot didn't work, or we've seen 15 people that their foot didn't work, and your nerve studies could tell us that we think that that's going to get stronger. It's just going to take some time. And that's encouraging, to them. And one, they're not the only one that has it. And two, the studies that we're doing look like, their nerve, like me, is going to get better, are going to respond. The muscles are going to respond. It's just crazy thing is we don't know. I started walking again in 6 weeks, and we've seen some people that are 6 months out that still have weakness, in their foot. And so, it's hard. Why does one person recover in a month and one person's 3 months and one person 6 months? So, the frustrating part for us is that I'm a doctor, Rhonda's a primary care, nurse practitioner. We fix things, and sometimes you can't fix it all at that time, and you can't give them the answer of when it's going to get better. You just feel like you encourage them to say, hey, I've seen people get better 3 months out, 6 months out. I'm a year out and I'm still recovering. So, it's to some degree it's frustrating, and to some degree it's very fulfilling, to see, we've seen it, the little girl I was telling you about, the art teacher, she actually went back to work.
Oh, good.
And to see that, and to see, I think Methodist did a story on her, if I'm not
But
mistaken.
she's still having a lot of problems with her legs burning and neuropathy, and she actually called last week, and so we're trying to support her. She's had a nerve conduction study, and Dr. Lay said it's going to get better, but it's just going to take some time. So we're here to just kind of support that and say you're going to get better, and look at the medicine, see if we can tweak the medicines any to be able to let her do her job and not hurt all the time. So
yeah, I can tell you from experience on that one. I had back surgery to alleviate nerve compression, and oh yeah, nerves heal really slow. I found
right, yeah.
It takes like a year. So yeah, I can see why that would drive her crazy though on that. But it is good. Like you said, I think a big part of what y'all are doing is providing hope for people that the weird thing about this disease is because it got all kinds of weird connotations attached to it along the way, and people don't talk about it much. And it's, there's a lot of people that have dealt with it just kind of quietly. So it's probably, if they're watching this, it's probably not like, good, I have options. I can actually heal and I can get help. And that's part of the reason why I wanted to have y'all on today.
Sure. And then, and I've started putting some things out up in the Delta. And like I said, going to this lady's church and saying, hey, these are things that, maybe these are questions you're afraid to ask. Maybe these are things you just wasn't sure was associated with, what you're going through. And you're not by yourself. There are a lot of people out there that probably have the same questions or concerns or fears that you have. And this is what I've seen, or this is how we can help. And, that I think a cool thing about this is that, like Rhonda was saying earlier, you don't have to be referred. I mean, I had a couple of patients say, oh, wow, I'm going to give them that number, and they can just call. We'll do the intake, and they'll ask you the questions. And if you're appropriate, excuse me, I'm sorry, then we'll get you in.
Yeah.
And we'll do everything we can to help.
And that number is 601-364-3392. And they can either ask for me, Rhonda Meadows, or just say that they have some questions about the recovery after COVID clinic, and someone will help you and probably get them to me. So it's just 601-364-3392.
Thank you. You beat me to the punch on that one, because I was going to have you throw that number out
Be
there.
sure you had it.
But I mean, like it said, I mean, you guys do a great job. You set this thing up. It's convenient because, you realize that the people that you're dealing with have lives that have been, not only they have lives, but they've had lives that have been interrupted, and they don't have a lot of energy to deal with. So y'all have managed a way to make this pretty easy for people to come and get the therapy too, which I appreciate.
No, that's great. No, we're happy to do it. We're excited about doing it, and it's yielded some good results so far. So, I think as we get farther along into it, we're going to get a little more knowledgeable, and hopefully, I think Dr. Lace is already, published or looking at publishing some papers that, he's had some feedback on. And the crazy thing, like talking to him, he said, it's funny talking to him because he said, I talked to a buddy of mine in Czechoslovakia yesterday, and we had a group chat with a guy in India, and I was like, wait, what? Yeah, because I'm doing good to talk to the guy in Greenville. So I'm just like, well,
it's affected the world.
Yeah, so it's funny because some of the work we're doing, like they had said, I actually had a lot of adenopathy, of big swollen lymph nodes, and I just did and they thought it was malignancy. They thought I had metastatic disease, but it was very, very aggressive. And went in and did some biopsies. It wasn't. It was actually probably still from the COVID.
Yeah.
And Dr. Lay suggested a couple of things that I do, and it's actually really made a huge difference. Very high dose steroids and for a short period of time, and those are one of the things that, seeing that response to care, and even myself kind of being the, I guess if you will, quote, guinea pig in that aspect of it. And that might be something that we could publish that really makes a huge difference. And because we know that COVID is a very inflammatory disease. A lot of what you see is from people will read about what's called cytokine storm, and basically that's just a huge inflammatory response that your body has to infection. And so some of that inflammation causes a lot of what we're seeing in the chronic illness, acute and chronic illness. Yeah. And so, being able to look at some studies and look at patients and do some therapies and see a response, this might be something that they use in other areas of the country, in other countries. If we can help that, knock down that initial immune, response, we may not have as many chronic long hauler disease down the road. And that's what we're trying to do. Not only help these patients that we're seeing, but maybe, help some people down the road as well, which, it's a really, to me, that's a really exciting and kind of cool thing to be part of. And it's that, next door opening kind of thing I was talking about earlier. Is never thought I'd be at this point in my career, but changing and seeing that aspect of it's pretty exciting to me. Something new for sure.
Yeah, and I mean, like I said, I when I heard about it, I was really excited because, like I said, I've talked to people that I know from all around the country that have been dealing with long-term COVID, and they're so frustrated because their doctor, like, look, I don't know what else to do. I don't know, or there's a certain degree, and that's one of the things I think you're perfect being in that role, because sometimes your doctors, and they're all great folks. I mean, I have friends that are doctors, so please let them forgive me for saying this, but sometimes they're busy. Sometimes they have other things going, and you say, look, I've got this problem right here. I've got this problem right here. And they might go, I don't know what else to say or do. And you're like, oh yeah, I had that too. And,
Right.
and that makes a big difference. If somebody's, like said, I'm just looking at all the different roles that jump in on this: nurse practitioner, of course, radiologist, wound care specialist. I'm kind of curious why a wound care specialist would be thrown in there. Nutritionist, like you said, you talk about inflammation. I imagine if you clean up your diet and get your inflammation down a little bit, that wouldn't hurt. Pharmacist, neuropsychologist, I can see that. Respiratory, speech, occupation, physical therapist. So, I mean, it's like y'all are throwing the whole kitchen sink at this.
Right. And we see a lot of people with still ongoing decubitus ulcers from being
in the bed for so long.
So, if that's an issue, we have that here too to help.
Yeah. Okay. Yeah.
I'm just trying to streamline it a little bit. I mean, if, the nutritional part, I lost 50 pounds.
Wow.
And some of it, I went from 225 to 175.
Yeah.
One, not only was the taste, well, I did have a sense of taste, just everything tasted absolutely horrible. And so weight loss, with some of these patients that come in, we have a nutritionist that, sometimes they do need to lose weight. In Mississippi, we have that problem a little bit. And sometimes we just need to kind of tweak their diet. So, not everybody has to see everybody on every visit. So we don't try to overutilize.
It's tailored.
But we have an ability to, we have occupational therapy, physical therapy, respiratory therapy, pulmonary. And then the pharmacist sees them, and we try to, kind of be, if you came in and your appetite was great and your weight was stable and your strength was improving, you don't need to see the nutritionist. But maybe your hands weren't as good, and you were depressed. So, we need to get the neuropsych people to talk to you and tell you what options you have to, what we can do to help you with, some of the anxiety or depression or things that you're going through, and who can we get you in to see? Because sometimes I don't think everything's cured with a pill. Let's get you to somebody you can talk to. And sometimes just the encouragement of knowing that, hey, this is going to get better helps. Sometimes seeing the therapist, or adding meds or providing you the number to a counselor may help. Seeing the wound care or setting it up where you are may help. Trying to restart some physical therapy or occupational therapy as an outpatient that may have dropped off. because that's just what insurances do now. Once you have, 6 visits, well, you're through, you can't do it. And, unfortunately, but if you get referred, they can continue to do sometimes their, occupation or physical therapy, even if it's through home health or an outpatient setting, which is great. So, whatever we can do to help, I think it's beneficial too. So, we'll be happy to see them. Just tell them to give us a call, or, physicians can refer in, and we have a flyer that we can, fax or email that they can print. I've sent it to a couple of hospitals, and they put it in the ER or their outpatient clinic settings. Yeah. So they at least know we're available, and patients can have that number up there, and it tells kind of what we do. And they can call in, ask questions, and again, we can get them set up. So, right now we're doing once a week. If it grows, we may expand that, because we had to kind of get our feet wet and figure out really what we were doing and,
right.
and how to do it, what was the best way and the most efficient way.
The first office visit does take about 2 hours, 2.5 hours to go through all of the evaluations. But then after that, the 1 month follow-up is like a regular doctor's visit to go through stuff. They won't need all the evaluations, but that first time is a long visit, but it's not, we keep them busy. There's no waiting for therapists to come down or anything. It's respiratory, physical therapy, occupational therapy, and it goes pretty quickly. Patients don't really have any downtime. But
then I see them before they leave,
yep.
So they see everybody else. I see them. They get checked in. We do their stuff. I talk to them for 30 minutes or so. They spend another hour and a half going around to all the disciplines. They come back down, and Rhonda lets me know they're back. Sometimes a lot of times we'll have their pulmonary function test, their breathing test back in hand. So we can walk in and say, your lungs are, a lot better than the last set of, oh, really? Oh, great. That's awesome. Or really, you're not recovering. Maybe I can make some suggestions. Or are you seeing your pulmonologist? Oh yeah, I'm seeing them next week. And we'll send a recommendation to pulmonologist. These are the pulmonary function tests we did. You might consider doing this or this or this. And so I'll go over what we have available and then ask, do you have any questions? Do you feel like it was productive? Do you feel like you got anything out of today? What can I tell you? What can I, what questions can I help you with right now before you leave? Because, obviously they spent 2 hours here and they've seen 10 people, and, pulling that all back down into, one ball of yarn and saying, hey, this is what we did. This is why we did it. Do you have any questions? That seems to help. And then, of course, their doctor, by the time they go see their physician again, we try to have that, recommendation letter out. This is what we did. This is what we saw, consider this and let us know if you need any help. And so I think that helps a lot, kind of closing out their day that they kind of spent with us that morning or that afternoon.
When you were on the ventilator and all that time, obviously you don't remember any of that because you're sedated and so forth. You wake up, you're bouncing all over the place. When you realize that you're paralyzed, that you can't move your feet, what was it that drove you that said, you know what, this isn't going to be how I'm going to be. I'm not going to stay in this bed. I'm going to, I'm in 3 months or 4 months, I'm going to be up walking and not on oxygen. I mean, did you have that in your head when you were doing that, or did you have people along the way that said, no, you can do this, and then you just kept moving the goalpost to get better?
Both. I had really amazing nurses that just refused to let me, one of the first things that my nurse could understand, one, they're terrible at charades. And that just made me even more frustrated. But one of the very first things they could make out was AMA. I wanted to sign out AMA, against medical advice. And she was like, are you kidding me? After everything I've done for you for a month, you still have a trach. And my brother told him, stick the paper to the door, and when he could walk over and sign it, then he could leave. And I was like, wait, what? But the other thing, so I had great motivational care. And the other thing that, makes me a little bit more emotional is, I have 3 daughters and a fiance, and knowing that for 21 days, they didn't know if they were going to come back the next morning and I was going to be there.
Wow.
my daughters would come, and for a while they weren't even able to come in. They would just sit outside the door and look at me. I just refused to allow that to limit me. I've always provided. I've always been dad. I've always coached their teams and, gone to everything. And I said, it broke my heart to know that they sat there and looked at me in a state where I had no control. And I've always been the one to, make sure that everything they needed was provided. And I said, that's every day it pushed me to work harder and harder, because I wanted to, one of the things I came here was, I would go and do 3.5 hours of therapy in the mornings, and then go back and eat lunch and rest a little bit. Then I text my girlfriend at the time and said, I've got wheels. And, they gave me an electric wheelchair, and she called the nurse's desk and she said, have you read his chart? Does that thing cut off when if he gets a certain amount, he's going to leave. He tried to sign on AMA and he was still on the vent. So I was like, so I would get in my wheelchair and go back down and try to, the therapists were nice enough that if somebody wasn't using the bike or something else, I would do another hour or so in the afternoons of therapy on my own, and just trying to push and get stronger and get back my ability to get up and do what I've always done. So those were my two big motivating things. I just refused. Once I had a little motion back, it was like, okay, it's on now. If I can move my fingers, I can move my hands. Dr. Rapai would come in every morning and go, high five, and I would go, I just thinking in my head, if I could punch you in the throat, if I could give you a high five, I wouldn't be laying in this dadgum hospital bed. So, and when she finally did meet me later, if you don't know Dr. Rapai, she's about this tall. And so the first time she saw me standing up, and she was like, oh my gosh, you're very tall. And I was like, yeah, you've only seen me, at bed level. And that's the only time you've ever seen me is when I've been hospitalized. But, it's been a pretty remarkable recovery, and I'm very blessed to be able to go through it. So, but I've had a lot of good care and a lot of good motivation along the way. So, the big thing to me is, having the opportunity to come back and give back and motivate and help some other people. Maybe that's a lot. It seems to help others too. So, maybe that is the reason I'm here,
Exactly. And I'm about to say, I know that probably drives you as much as anything. I mean, I had 3 doctors miss my melanoma, so I've always wondered, why am I here? It's like, okay, well, it's time to make a purpose. Well, I am here, Right. I totally get that. Rhonda, like I said, thank you for all you're doing too on getting everything organized, getting the clinic going. It's a, like I said, I think it's a model that obviously is going to be copied everywhere. And as the need seems to be increasing, particularly with the current numbers that we're having, I know there's going to be a lot more people, unfortunately, having to come see y'all. Is there anything I've missed? I mean, I've tried to cover about it, everything I can think of, but some days I don't think so well anymore. So
I think you did great. You covered everything. You gave us the opportunity to cover things too.
Here to help the citizens of Mississippi, and this and having COVID is bad enough, and now they're maybe depressed, or they're just need to have some encouragement to get on the right track, and let us do some see how we can help them.
And we're working such an underserved area, anyway, we're the rural South, and there are so many corners of the state that don't have that opportunity. So getting the word out there, having the ability to come, knowing that we're going to see them or accept them, and try to tie what they have going on in with others that can maybe help motivate them as well, and realizing there's a treatment. You don't just have to accept the fact that well, this is just what it is, or sometimes even just recognition, realizing that, hey, maybe at 39, being short of breath all the time is not normal. This could be related to the COVID I had last fall, Yeah,
and just knowing that they're not alone with the symptoms that they're having. We've probably seen it in the COVID clinic, and we can figure out how to help them, what works and what didn't work.
Yeah, hope is a huge part of it too. And I think part of the reason like I said, I heard your story, Dr. Montesi, it was just, I was thinking about, I still get the comments on some of my cartoons that it's 99.7% survivable, which is not the right statistic in Mississippi. But even then, like you're saying, when you get up to 40% or whatever that might have long COVID, that survivable has a different meaning. And I know a lot of people see that, and you start seeing comments where people are like, well, yeah, but I can't do this, that, and the other. And I just realized y'all have a solution, and a lot of people need to find it. So I wanted to be able to talk to you today about it.
Well, thank you for getting the word out. Thank you for sharing, for everything that you do. And, like I said, if you ever need us to do anything, we're available. I can't travel or function outside of Methodist. So just let me know if you have anybody that I can help with or talk to. I'm sure Rhonda's the same way, or Methodist itself we have the ability to, reach out or do the best we can to, that's what we do here anyway. So, it's pretty amazing, some of the stories I've heard from other people that have motivated me.
Yeah.
And so I think it does. You don't ever realize, and sometimes it sounds kind of cheesy or corny, but, it does. I mean, I think when I was here, I actually came down. If you've been in Methodist, they have these big posters up on the wall that talk about stories about people coming in. And I think I read every one of them while I was here, because, here I am, 51, 50 at the time, year-old, guy that was, growing up in the Delta. I'd get off work and then get on a tractor for 4 hours and then go coach my daughter's softball team and, that sort of thing. And, now here I am literally sitting in a wheelchair reading a story about, somebody else who is now back to work after rehabilitation, right where I'm sitting. And so it's that motivation, does help. When you have that frustration, have that, I guess, inability to say I'm going to go back to normal, to see somebody else that made it too.
Yeah,
it does push you a little bit. So.
Yeah, wasn't Chris Gill? I think he had a poster there for a long time. He was a musician. He got in a car wreck.
Yeah.
Shouldn't be. Because I remember the poster on that. Chris is a walking miracle. And so you're right, those stories do absolutely inspire you. When I had my back surgery, I was in the same hospital you were in, and we were up above the floor above the ICUs. And there was this, they literally got me out of bed right away and had me walking, because of spinal surgery. And I'm walking past the ICUs. I can see them through this little corridor I'm walking across. I can look down and see those windows. And I kept thinking, I have no problems. I have no problem.
It does. And it was because when I was there, I was one of the few that actually woke up. And I actually went back to visit the nurses that took care of me. I went down for an oncology visit with Dr. Baker. And then when I came back through, my fiance is one of the pharmacy directors at long-term acute care there, Baptist. So I would go back by and I would speak to the nurses. And when I went in, the same nurse that said, "Are you kidding me? You're going to sign out AMA?" She just walked up to me and just started bawling and hugged me. And she said, "It means so much to know that I took care of somebody that's actually walking."
Oh, wow.
And she said, because they see so much, so many people that don't make it. And I think they had coded 3 or 4 patients that day. And I mean, she didn't even say anything. I was still dragging my oxygen behind me, and she just walked up and put her arms around me and was like, "I needed that today. I needed to see you." Because, sometimes we don't have the follow-up that somebody actually made it, that's getting better, that continues to improve. And so, even those patients, even the lady, the nurse that motivated me and pushed me and wouldn't let me quit, she needed that too. And just to know that what she did, made a difference or it mattered. And I don't have any doubt that they kept me alive while I didn't even know I was in this world. So, big thanks to them and the work they do. And, I'm just happy to have the opportunity to go back and doing what we're doing here. So we appreciate you getting the word out there. And I appreciate Methodist giving, us the opportunity to do that.
Me too. Hey, Rhonda, a quick question. Is he always this inspirational? Or is this just something he's doing just for this?
He is. I enjoy working with him. I do.
I can see
it's
that.
been a pleasure. Yes.
Yeah. No, I've enjoyed this conversation too. I really appreciate both of you taking the time out of your busy day. I mean, as we're recording this, it's like really windy and rainy. So I'm sure a lot of people didn't come out to come see y'all today, but I appreciate it. And like I said, if you ever need anything, just let me know. And Rhonda, throw out that phone number one more time, just so that folks can know who to call.
It's 601 888-364-3392.
I appreciate both of you very much. And, Dr. Montesi, I wish you well on the melanoma fight too.
Thank
It
you.
sounds like you've got it well in hand. They've come a long way with the treatment for that. That's for sure.
They really have. And I told them, I said, I'm glad, Ryan was my fiance. I said, I'm glad Ryan, big scars, because I'm scarred up from one end to the other. So, I guess we'll go with that. It makes me look tough, I guess. So we'll go with it. Messed up my modeling career as well as a side model, I guess. So,
Yeah, you can steal my shark attack joke that I used at the beach. And my kids were little and they saw my scars on my back and they said, "Dad, where did you get those from?" I said, "I fought pirates." And they said, "They're on your back. Were you running away?" Thanks, guys. I appreciate it.
Yeah, that's the kids. Mouths of babes.
They are my children. They're they're smart Alex. But thank y'all both so much for today. This has been fun.
Thank you, and we enjoy it. Thank you. I appreciate you having us.
I appreciate it.
There.
All right. Thank you.
Thank you for watching this episode of Mississippi Stories. Make sure to subscribe to the Mississippi Today YouTube channel and click the bell to be notified every time a new video uploads.